Hi, I am New York plastic surgeon Dr. David Rapaport, and what I want to talk to you about now is anesthesia for liposuction. And this is an important topic. It's an important topic because anesthesia can kill you. And you're getting anesthesia in some way, possibly, to make you comfortable for a procedure, but you never want to have more anesthesia than you need. So when I do liposuction, I am using that philosophy, and the beauty of liposuction is that the first stage of lipo is always numbing the area. And so the moments of discomfort during lipo are small and limited. Therefore, when you're having one area done, like just submental, or let's say just the arms, or just the waist, in the vast majority of cases, you can do that without an IV and without an anesthesiologist, with just some pre-medication, something we give you orally to make you comfortable in terms of reducing anxiety, possibly reducing pain, and then you can have the procedure with no IV, the ultimate in safety, because you're there, you're breathing on your own. Nobody's taking over anything from you, and it's a good experience. I can tell you of my own experience. I've never had lipo. But I've had dental work where I've taken the exact same drugs I give my patients, and when I take these drugs, I don't remember a thing. So, and I've done this many times. I saw 2 follow-ups today. It just works very well. And 99% of lipos that we do of the submental, the double chin, are local. They don't need more. But let's say you're doing 2 areas or 3. Let's say you're doing upper lower abdomen, hips, waist, maybe inner outer thighs, a very common combo, that trunk combo. That's going to be too much, in my opinion, for anybody to do under local and have a good experience. So in cases like that, we're using IV anesthesia by a board-certified anesthesiologist, and the key is that, again, we're not taking over your respiratory system. You're breathing on your own. You are in a twilight place. So if I say, shake you, you're sleeping and I want you to turn, David, wake up, bend your knees, time to turn. You're responsive. And that's the key. Don't let people take over your respirations if they don't have to. It's better to breathe on your own. You don't screw it up. You know what I'm saying? So that's my philosophy with anesthesia. I am actually taking a position against general anesthesia for almost all cases if all you're doing is lipo. I think it's safer. I've been doing this for 30 years. Thank God. Where's wood? Paper, no death, no emergency transfer to the hospital. It's all been good, and we want to keep it that way. So those are my thoughts on anesthesia for lipo, with the one thing I didn't tell you. Lipo is injecting and numbing the area, and that's why we can do it that way. So you only need to be a little more in a different place while I'm numbing you. And then the rest of it is just controlling little bits of pain that you might have, and the anesthesia can help you with that. Okay.